Hello, welcome to our frequently asked questions. Today I'm answering a commonly asked question about smoking and whether I can smoke and have upper blepharoplasty. And in answering this question, we'll talk about, what are the effects of smoking on the eyelid and the face in general? What do I need to do in terms of before surgery, in terms of smoking? Can I use nicotine patches? Can I use vapor? And finally, what can I do to reduce the risks as far as possible in terms of smoking and eyelid surgery? My name is Dr. Julian De Silva, and I'm a London-based facial cosmetic and plastic surgeon, and blepharoplasty and upper eyelid surgery is surgery that I perform every day for my patients, and the information that I'm discussing with you today is information that I share with my patients on a daily basis. And so, with regards to smoking, what are the effects of smoking on the body and on the face? Well, if we start by looking at how smoking affects healing, the skin requires oxygen and nutrients in order for it to be normal and to heal naturally. And so smoking interferes with the way oxygen is carried around the body and affects the skin and healing time that occurs from this. And so smoking cigarettes or a pipe has an effect of reducing healing time and increasing the chance of things like infections and delayed healing and scarring, which can be a consequence of both of these. Another way that smoking affects your healing is it can impair your threshold for discomfort and pain. And so it's been well documented in the scientific literature that you can have a more sensitive healing period where analgesics and pain relief medicine may not be as effective as those in non-smoking patients. Having said that, most patients don't have a great deal of discomfort after upper blepharoplasty, and so discomfort is not generally an issue in patients healing in this way. So next, if we look at the effect of smoking on facial aging, and there have been some quite interesting studies looking at the effects of smoking on aging, and one particularly interesting study was in identical twins, where one twin had smoked for over 10 years and the second twin had not smoked. Well, the twin who had smoked over that period had looked considerably older as a result of the smoking. The quality of the person's skin, the lines, the wrinkles, the loss of natural volume in the face, all these elements have been exaggerated or enhanced in the smoking group, really showing us that one of the ways you can truly benefit and stay more youthful looking is to stop smoking completely. And over a period of time, over a period of years, that will reduce the effects of aging. Another element is your general health and the effects of smoking. Smoke has over 4,000 different ingredients with it, which are thought to be toxic to the human body. And really, the effects of smoking can really affect all parts of the body in different ways. And particularly relevant to surgery is the effects on the chest, but effects on the skin, effects on the constituents of your blood. Overall, the health benefits of stopping smoking are really quite significant. In addition, nicotine, which is the kind of ingredient that is addictive in smoking, this has an effect on blood vessels, causing constriction and narrowing of the blood vessels, and this effect can actually affect healing in its own right and reduce healing, giving you delayed healing, increase the chances of infection and scarring as a result. Do I need to stop smoking before eyelid surgery? I advise all my patients who smoke, who are looking to have upper blepharoplasty, that it would be in their best interest to stop smoking for 6 weeks before and after surgery to ensure that they have the fastest healing and the best possible natural looking results from the surgery. In some ways, the eyelids are fortunate in they have a very comprehensive natural blood supply, and this is really beautifully illustrated by the anatomy by von Hagen, in which the intricate architecture of the blood supplies to the face is so beautifully shown. At the same time, this incredible blood supply ensures that healing generally around the eyelids is relatively fast and relatively good. Of course, there are exceptions to this where there may have been previous surgery, such as revision surgery, if you have other medical conditions such as diabetes, but overall, if you're unable to stop smoking for upper blepharoplasty, it is not going to stop you having the surgery as it may do for other surgeries around the face. So the advice I give to all my patients, if you are able to, please stop smoking for 6 weeks before and 6 weeks after surgery, as this will give you the best possible result. How about nicotine patches? Well, unfortunately, one of the effects of nicotine is to constrict blood vessels in the face, and this in its own right can affect healing. So unfortunately, using nicotine patches as an alternative to smoking is not that helpful. And really, if you are going to stop smoking, you also need to avoid nicotine patches. How about vapor? Well, vaping certainly has some benefits over smoking because some of the toxic ingredients that are in cigarette smoking are not present in vaping. However, at the moment, the evidence is really not there, and there certainly are some ingredients in vaping that are toxic, and how toxic they are to healing and recovery is something that we just don't know. We do know that nicotine is potentially toxic and causes delayed healing, and so vaping needs to avoid nicotine in order to be sure that you have the best possible healing and best possible result. So in terms of reducing the risks, what can you do to ensure that you have the fastest possible healing after upper blepharoplasty? Well, if you can, my advice would be to stop smoking completely for 6 weeks before and 6 weeks after surgery. In addition to that, in terms of the anaesthesia used, well, local anaesthetic or sedation anaesthesia have marked benefits over general anaesthetic when it comes to smoking, as smoking can affect your general health and chest, and so local anaesthetic and sedation anaesthesia are generally regarded as safer, as these do not affect the body in the same way as general anaesthetic. In addition to that, there are measures that can be taken in the surgery to enhance the recovery, particularly with relevance to smoking, and this can be the degree of surgery that is conducted, and certainly more conservative surgery will tend to heal faster. And also additional techniques, for example, platelet-rich plasma, while using your own body's growth factors to heal the body faster. Well, this will tend to counterbalance some of the more harmful effects of smoking by enhancing your recovery. So in summary, we've talked about the effects of smoking and how this impacts both your eyelids, your face in general, and also general health factors. We've talked about the effects of smoking in regards to surgery. We've talked about other products such as nicotine patches and vaping. And we've also talked about factors that you can do to help reduce downtime and enhance recovery if you are smoking when having upper blepharoplasty. I hope this information has been useful for you. Thank you for watching.